10 early warning signs of a heart attack. And number 1 is the one most people in emergency rooms say they ignored for weeks before everything went wrong. Number 10. Unexplained fatigue that hits out of nowhere. When a coronary artery starts narrowing, your heart works harder to push blood through, and that extra effort drains energy from the rest of your body silently. Number 9. Mild chest discomfort that comes and goes. Not the dramatic crushing pain from movies, a dull pressure, tightness, or squeezing sensation that appears and disappears and gets dismissed as indigestion. Number 8. Shortness of breath, doing things that never wondered you before. The heart is struggling to circulate oxygenated blood efficiently, and the lungs feel it first. Number 7. Pain or discomfort spreading into the left arm, shoulder, jaw, or back. The nerves serving the heart share pathways with these areas, and referred pain is one of the oldest warning signals the body sends. Number 6. Nausea or stomach pain with no obvious digestive cause. The vagus nerve connects the heart directly to the gut, and cardiac stress frequently shows up as digestive discomfort first. Number 5. Cold sweats breaking out for no reason. Your nervous system is triggering a stress response to a cardiovascular system that is losing its ability to maintain normal circulation. Number 4. Lightheadedness or sudden dizziness. Reduced blood flow to the brain from a struggling heart drops blood pressure and oxygen delivery at the same time. Number 3. Heart palpitations. A fluttering, racing, or irregular heartbeat that appears without exertion. The electrical system of the heart is reacting to reduced blood supply to the cardiac muscle itself. Number 2. Swollen ankles and feet that were not there before. A heart under sustained stress loses pumping efficiency, and fluid backs up into the lower extremities as a direct result. Number 1. A feeling that something is simply wrong. An unexplained sense of doom or unease with no clear cause. Cardiologists call this impending doom, and it appears consistently in the accounts of heart attack survivors who say they knew something was coming before any other symptom arrived. So share this with someone in the United States, because heart disease is still the number 1 cause of death there, and most of the people it takes had warning signs they did not recognize. Why do cramps hurt so much? Your muscle is being forced to squeeze as hard as it possibly can, and it will not stop. When you move normally, your brain sends a signal through your spinal cord, telling a muscle to contract, then release. Contract, release. That is the full cycle. During a cramp, that cycle breaks. The motor neurons in your spinal cord start firing on their own without your brain telling them to, and they refuse to stop. Your muscle receives the command to tighten, but never receives the command to let go. So it keeps squeezing harder and harder until it locks into that rock-hard knot you can feel pressing through your skin. The reason you cannot relax through it is because your brain is not in control anymore. The problem is happening in your spine, not your head. No matter how hard you try to calm down, your nervous system keeps screaming at that muscle to contract, and your brain cannot override it. Scientists describe it as a seizure happening in a single muscle instead of the whole body. This is exactly why stretching is the only thing that actually works. When you stretch the cramping muscle, you force the opposing muscle on the other side to activate. That competing signal is strong enough to finally interrupt the loop and make the motor neurons shut off.